And now it is time for another fireside chat about your pet's health. Coming to you from the world headquarters of the Pennsylvania Veterinary Medical Association in Hummelstown, Pennsylvania.
Hello again, everybody. Welcome back to the next installment of our Fireside Chat series regarding your pet's health and taking care of them. My name is Dr. Bryan Langlois. I'm a board member of the Pennsylvania Veterinary Foundation as well as a member of the Pennsylvania Veterinary Medical Association. And as you can see, we're back here in front of our fireplace, still working on getting the wood for it, but we have added some wonderful decorations just to make things a little more homey. Since we last chatted, I hope everybody's kind of staying warm, along with their pets are keeping warm with all of the bad winter weather we've been having lately. Polar vortex, thankfully, has kind of gone back up north, and now we're just kind of dealing with the snow and the ice that hopefully will be done soon. As we kind of go into February, February is basically known as Pet Dental Health Month. And one area that is probably one of the most neglected areas of people when they take care of the pets is their animals' teeth. And teeth are basically kind of the gateway to the body, as we say. As goes the teeth, as goes the animal. So it's really, really important that you have your animal examined again yearly, as we talked about in our last segment. And one of those things that will always be looked at on those yearly visits is their teeth and the state that their teeth are in. Your vet may look over and just recommend, some brushing of your pet's teeth. They may recommend something such as what we call a dental prophylaxis, where your animal is put under a very short anesthetic and has their teeth professionally cleaned and scaled and polished, the same way that we would have it done at our dental office or our dentist every 6 months. You probably don't have to worry about it every 6 months in most animals, but sometimes every year or every 2 years, it's not a bad thing to go on. And I know people are kind of very, very hesitant and concerned about the anesthetics that may be used in that and the need for anesthesia. And I can say that it really is the safest way to go about it to ensure that there's no secondary complications from the dental. Unfortunately, we really can't get our pets to sit still like we do at the dentist, or if you're like me, you'd probably actually have to sedate me to go to the dentist as well. In order to make sure that we do get under their gums and clean all the areas that need to be clean. And it's really important that in between those times that you do monitor your pet's teeth and see how they're doing. It's very easy to go about cleaning your pet's teeth. Basically, you can do it with something as simple as just some rolled up, really old gauze on your finger. The really cheap gauze that you can get at the drugstore and stuff like that. You can dip it in a little bit of chicken broth just for a little bit of taste. For the pet, and all you really have to do is just kind of massage right on the tooth gum line. It's the mechanical abrasion that gets it off. You certainly can look at using things like pet toothpastes, the toothbrushes and things like that you can buy in the pet store. Those work as well. But you also want to remember to start very slowly. If you can get one tooth done the first time before your dog or cat kind of says, "I've had enough," that's perfectly okay. And then kind of work your way up. If you have a new puppy or kitten in the house, get them used to now you kind of lifting up their lips, looking in their mouths, looking at their teeth, things like that, because it'll make it a lot easier once their adult teeth come in to be able to brush them later on. So those are all really important things to look at as you're looking at your pet's health. What we're going to do now is everybody's kind of concerned, well, what can happen? What happens if I don't do anything? What is my vet talking about when they have certain conditions they notice with the teeth and things like that? So what we're going to do now is look at some pictures of various stages of concerns with dental disease and kind of describe exactly what we're seeing and things like that. So we'll go ahead and take a look at some of those pictures and then come back to kind of like sum everything up and see how we can help you guys take care of your pet's teeth.
Okay, so the first thing we're looking at here is just a quick picture of what we would consider grade 1 dental disease. You can see the areas that are circled. We have a little bit of tartar that's built up on the teeth, especially towards the back. This is the kind of thing where you basically can do it at home, brushing to get that off with the mechanical abrasion and things of that nature. Notice the gums are nice and pink. There doesn't appear to be any redness or inflammation, things like that. Most animals, if they're not don't have their teeth brushed regularly, are going to have this kind of thing come on. We kind of move now into what we call grade 2 dental disease. And this is where we have kind of an issue where you can start to see the same amount of tartar, but you can notice in certain areas, especially in the circled areas, the gum is starting to get a little bit reddened, a little bit inflamed. So this would kind of be the next stage up. It would be hard to kind of take care of this just with regular brushing, and it's these kind of things usually do end up requiring a basic dental prophylaxis at your vet. But if it's very, very mild, sometimes brushing can just take care of it. Then we kind of move on to what we consider grade 3 dental disease, and this definitely requires a veterinarian's care as far as taking care of things prophylactically and with scaling and polishing. And you can notice how much more tartar and actually what we call calculus, which is hardened tartar, that has built up on the teeth as well. And, that's obviously a concern. That has to be scraped off and scaled off, as well as some gum resorption going on there too, which has to be addressed by your vet. And then finally, we get into something as serious as this. And this is one of the dogs that I have seen at the shelter. This is considered grade 4, really, really severe dental disease, where the calculus basically has covered the entire arcade of the teeth. You can't even make out individual teeth. And the area that's very lightly circled there is actually an area of severe infection and pus that's going on along the gum line. Actually, when you crack the calculus off these teeth, you will notice that the teeth basically almost just fall out. This is really severe and hopefully would never get to this kind of level. And then finally, one quick thing I wanted to mention is something we call a tooth root abscess. And sometimes people will see on dogs or cats this swelling that is just under the eye. And it seems painful. The dog or cat doesn't seem to want to eat. And a lot of times they think it's something like, that's going on in or around the eye. And it's actually a result of just the tooth root area becoming abscessed. And that's something that has to actually be taken care of by your vet. So if you notice that kind of swelling, be sure to definitely let your vet know what's going on there. Just something quick to.
All right, so I hope that was a good overview of the different grades of what we call dental disease. I know sometimes everybody gets freaked out when they hear disease, but basically the grading dental disease and things like that is just a term that we use. So this way, if your pet is seen by a veterinary dentist or needs to be seen by another veterinarian, they have an idea of exactly what's been going on. So I hope that was kind of just a quick, good refresher showing you guys exactly what each of those grades means, the concerns with them, and things like that. Now, sort of the same with us, people ask, well, my pet seems to be eating fine, doesn't seem to be bothered by it, things like that. And that may appear true on the face, but you have to remember, eating is one of the most basic tenets of survival, if you look at it from a pure survival thing. So most pets are going to do what they have to do to make sure that they continue eating, and that can be something as simple as just not chewing. If it really hurts that much to chew, a lot of them will just try to swallow the kibble pieces whole, or some of that wet food. If you feed it to them, they'll swallow that whole as well. So it's always important to monitor your pet's mouth to see if it appears to be painful anywhere. A couple of the signs that you can look for that there might be a dental problem include them kind of chewing on one side of their mouth, maybe even turning their head a little bit. They can be pawing at their mouth a lot on the side where a tooth may hurt. Everybody usually notices the odor that can happen with pets' mouths when their teeth are bad, so that certainly is a tip-off. But usually once you get to that odor stage, it's been something that's been going on for a while, so we actually want to try to catch it before then. And again, one of those ways that you can catch it is have your pet examined regularly at your local veterinarian. This will allow them to get a good look at the teeth and see if anything needs to be done before they get to that kind of infected stage. Just like us, when you get to severe periodontal disease, as we showed previously, the biggest concern is not always so much for the teeth themselves, as we can treat those things, but infection, if you think about it, there's a lot of blood supply to the gum and the tooth area to keep everything healthy, and any kind of infection that sits in there certainly can spread to other areas of the body. So we do worry about what we call hematogenous spread, which can spread these bacteria to organs such as the kidney, the liver, even the brain, areas like that, where you can get a much more serious whole body infection going on, and we don't want that to happen at all. So it's really important that you keep on top of your pet's dental health. Any kind of little concern with a tooth is a problem. The cats especially, sometimes we do see these what we call resorptive lesions, which happen right along the gum line, which are incredibly, incredibly painful for cats. And so, your veterinarian can look at the teeth and determine if something like that is going on. Again, it's really important to make sure that they are seen at least once a year. If they happen to be older animals that have had dental problems, maybe having them seen every 6 months just for a quick dental checkup to make sure things aren't getting worse. All of those things are really, really important. So I hope this next segment has been pretty informative for you. If you are looking for more dental tips and things like that, the Pennsylvania Veterinary Medical Association has a great fact sheet out on this sort of thing. If you just go to pavma.org, again, that's pavma.org, you can find the information there. It's a wonderful fact sheet that can be printed out. Your vet may even have it in his or her office. That gives a lot of information out there. And please, remember to check out the Medical Association and especially the Pennsylvania Veterinary Foundation, who will be doing a lot more in the coming year to promote things for your pet's health as far as all of that stuff goes. So make sure to brush your teeth, brush your own teeth twice daily, and make sure you brush your pet's teeth daily if possible, and don't neglect your pet's teeth. It can lead to really dire consequences. Some of the stuff that we've shown a little bit previously. So again, hope you've enjoyed this latest installment of Fireside Chats with Your Pet's Health. We'll be back probably in a little bit mid-month with a little bit more information about a special upcoming event that will be happening towards the end of February regarding your pet's health, and something that I hope you'll realize a lot of organizations are participating in. So until then, again, this is Dr. Bryan Langlois, member of the Pennsylvania Veterinary Foundation and the PVMA. Hope to see you next time.
For some more information about your pet's dental health and needs, be sure to visit the following website where you can get a wonderful fact sheet from the Pennsylvania Veterinary Medical Association about the needs of your pet's dental health. As a reminder, anything that is presented in these fireside chat videos is for informational purposes only. Remember that only your vet can make a diagnosis on your particular animal, so please do not try to treat or diagnose your animal based on anything you see in these videos.